Hey everyone, it's Tangie. Hope you're having a wonderful day. So today we'll continue with our GLP-1 series. I will cover Mounjaro and Zepbound and how it's different from Ozempic and Wegovy. I'll also cover some of the questions I received about the compounded versions. So stay tuned for that. And today's video will be brief because we covered a lot of information in part one, and much of that is the same for Mounjaro and Zepbound. So let's get started. So what is tirzepatide? That is the generic of Mounjaro and Zepbound. And how is it different from semaglutide? Well, I would say it has sort of a dual action. While semaglutide only works on the GLP-1 receptors, tirzepatide works on both GLP-1 and GIP receptors. And I put in there what that means. The GIP hormone is also released in your stomach after eating, and that signals the pancreas to release insulin. And combining that GLP-1 with the GIP, that's where you get enhanced appetite suppressing and weight reducing effects. So I thought this chart would be helpful to break it down a bit further for you and compare these medications. So we see that Mounjaro and Ozempic are FDA approved for diabetes. Zepbound and Wegovy are FDA approved for weight management. And again, the criteria is the same for eligibility. BMI greater than or equal to 30 is an automatic qualification, or your BMI greater than or equal to 27 with a documented comorbidity is a qualification. So the big takeaway here from this chart is that neither of the tirzepatide medications are approved for use in the pediatric population. And the side effects, adverse contraindications are pretty much all the same with these medications. Although I've had some patients report that there are less side effects with tirzepatide. But again, that is based on the individual patient. It is important to note that tirzepatide is only available as an injectable, whereas semaglutide is available in the pill form. The starting dose here is 2.5 milligrams weekly, and that can be titrated every 4 weeks up to 5, 10, with a maximum of 15 milligrams. Again, you do not have to fly through the doses. Stay at a dose as long as possible, as long as it is therapeutic for you. This part is very important. We know that these medications are available everywhere now. You can just go online and order it. And I think it's very dangerous because there is no oversight. You have to understand that these compounded versions of the medications are not FDA approved. There is no way to be sure what you're getting when you order them online. So if you do decide, however, to continue with a compounded version due to cost or eligibility reasons, just ask yourself these questions before signing up or ordering any medication online. Did you talk to an actual healthcare provider? Did that person, the healthcare provider, did they review your medical history? Are they ensuring that you're a candidate, there's no contraindications? Did they do baseline labs or vitals? Although that's not a requirement, but I personally think it's important because how else can we know what's happening inside your body? How can we determine your success based on, besides what the scale says? Are you routinely seeing this provider? Are they available for questions or concerns that you have? You have to consider all these factors prior to making a decision and ordering a medication online. And that's it, guys. As always, I am here to answer any questions you may have. You can call me, email me, schedule an appointment, send me a message online. Whatever you need, I'm here for you. Talk to you soon. Bye.